Hi, I'm Chris Walker, Head of Health and Safety at Napthens Health and Safety, and it's that time of the month again where I share a health and safety update with you and look to provide some useful reminders and guidance on your key health and safety responsibilities. Now, if you've listened to some of our previous recordings on subjects such as incident reporting, risk assessments, slip, strips, falls, Legionella risk management, and manual handling, then you'll know how the format works. If you haven't heard any of this previous content, I do recommend you go back and explore those previous recordings and encourage your staff and colleagues to do the same as well. These recordings can help in terms of providing a really good platform for further health and safety discussion and assist in improving compliance with safety rules and regulations, as well as helping you to involve those who work with you, perhaps assist them with improving your overall health and safety culture and performance. Before we get stuck into the detail of today's health and safety subject, I just wanted to bring you the latest figures released by the Health and Safety Executive as a bit of a reminder, if it were needed, as to why all of this health and safety stuff matters so much. At the beginning of July, the HSE revealed its fatal workplace accident statistics for Great Britain for the period 2020-2021. A total of 142 workers were killed in work-related accidents, representing a sharp rise of 29 from the previous period, which itself was something of a record low. Although this number, 142, is a broadly typical annual figure for GB workplaces, it is slightly higher than the 5-year average figure. The 142 represents only fatalities resulting from accidents specifically, and does not include the vast array of worker deaths that are linked to workplace occupational health conditions. And the HSE noted specifically on release of these figures that accordingly they do not include deaths arising from occupational diseases, which include COVID-19. Now, more than half of these accident fatalities recorded were linked to falls from height, being struck by a moving vehicle and being struck by a moving object, with falls from height themselves accounting for 35 lost workers' lives. Now, for me, these figures raise a few questions. Not least, is it possible that during this period, 2020-2021, that workplace health and safety focus shifted to COVID-19 control at the expense of other key risk management issues? At the beginning of 2020, or the beginning of April 2020, I wrote in an article which was calling for business to consider its risks beyond virus transmission and not to lose focus on its health and safety priorities, that hand sanitizer wouldn't stop anybody falling off a ladder. Now, while that analogy might not apply directly to the entirety of the care sector, there's a clear case for considering at this point whether or not any of our normal health and safety arrangements have suffered as a result of an understandably altered focus. How's your business as usual health and safety management going right now? Has COVID-19 taken your eye off the ball on the common hazards in your workplace? And has this led to an increase in any particular types of incidents or injuries? We expect far more information on the nature of work-related ill health and non-fatal accidents for this same time period from the HSE in December 2021. It will certainly be of interest to see the impacts of 12 months of working through a pandemic, not least on areas such as work-related mental ill health. Now, while checking out these latest HSE figures, my attention was also caught by the latest reports from the HSE into deaths resulting from mesothelioma. For those who aren't already aware, that's a form of cancer linked to exposure to the hazard that's the subject of our main focus today, asbestos. While the latest figures report a reduction in annual deaths from mesothelioma, there was still a quite astonishing 2,369 deaths in the period, the majority of which will have resulted from an occupational exposure to asbestos. With such high numbers of deaths, as well as many more thousands of workers suffering a range of life-limiting breathing disorders as a result of exposures to asbestos, then it's no wonder there are strict rules and regulations around its management. But are you aware of what those rules are and how they apply in your setting? The Control of Asbestos Regulations 2012 outlines specific duties for managing the risks associated with asbestos in buildings. If you own, manage, are responsible for, or maintain any premises, including care homes and associated buildings and structures, then you will need to be aware of the requirements of these regulations and you will have some specific legal duties. Ultimately, if you're responsible for the building, then you're responsible for knowing whether or not there is asbestos in it. what condition that asbestos is in, and for managing the risks from people becoming exposed to it. This includes managing the risks presented by the asbestos that might affect your staff, your service users, your visitors, maintenance personnel, and any contractors. If you have asbestos in your premises, you will have a duty to make sure that any visiting contractors and those performing maintenance of any kind which may disturb the fabric of the building are provided with sufficient information to allow them to avoid it. You'll also need a plan in case something goes wrong. How will you ensure the protection of people if property damage occurs, releasing asbestos, or there's accidental disturbance of asbestos on site? Prompt action will be vital to control the risks, and such situations may, in some circumstances, be reportable to the Health and Safety Executive under RIDDOR. Now, the good news is that despite its many marvellous properties, which made its use prolific in building and construction around the world, the hazards to human health associated with asbestos are widely recognised, and the importing and use of asbestos and asbestos-containing materials has been banned in the UK since 1999. As a short aside, the mining and use of asbestos continues in many countries around the world despite all the hazards, but we won't go extensively into that right now. The challenge we face in the UK, and the challenge that you may be duty-bound to tackle, is that due to its prolific use in building, construction and refurbishment work between 1950 and 2000, there is a vast amount of properties in use today which contain asbestos. Unless your property was built after 2000 in its entirety, you will need a robust answer to the following questions. Does my premises have asbestos? And if it does, how am I managing the risks? It is not adequate for a duty holder, the person in control of a premises, to ignore the potential for the presence of asbestos and its associated risks. If your premises might have asbestos, and it's certainly very possible if it was built pre-2000, then you need to gather information on it. Maintain an easily accessible record of its location, the type of material, its condition, and the type of asbestos. And ultimately, in order to do this, you'll need to instruct a competent person to survey your premises and present you with a report of their findings. This report of a survey of your premises will highlight the risks presented by each specific asbestos-containing material identified and provide a recommended action plan based on the findings. Actions required following an asbestos survey may include making repairs, sealing, enclosing or removing the asbestos, and all of these activities will require competent and in some cases appropriately licensed specialists. They're not things that can just be attempted by anybody. If asbestos is found to be safe to leave where it is, then that's great, but it doesn't represent the end of your responsibilities. As a duty holder, you're required to implement a suitable asbestos management plan, which should be recorded along with checks, regular reinspection, and condition monitoring of the materials. You must keep this management plan up to date and actively manage the risks. It's simply not enough to rely on a survey from 10 years ago, for example. You need to know what condition the asbestos is in now and whether or not it presents an ongoing risk to the occupants of your premises. Anybody who might disturb the asbestos in the course of their works needs to be shown this plan and the locations of materials on site. This includes contractors. You'll need to ensure that any of your staff or maintenance workers that are directly employed and specifically may encounter asbestos during their work on your site are provided with suitable awareness training. You need to help these workers recognise asbestos, avoid it, and know what to do in the event of an incident. I'd encourage you to check on your current arrangements as soon as you can. If it's possible that you have asbestos in your premises, if it's possible you have asbestos to manage, are you doing it? If your building could contain asbestos, do you have a survey and a management plan? And if so, when was the last time you reviewed that management plan and re-inspected and reassessed the condition of asbestos-containing materials in your facility? As well as protecting the health of those who use your premises, compliance with the control of asbestos regulations will avoid you becoming one of the countless businesses fined for failures to properly manage the risks of asbestos. In July alone, prosecutions, including a £25,000 fine, doubled by costs, 6-month imprisonment of a director, and a further business fine £22,000 for asbestos management failures have been well publicised. I would like to thank you all for taking the time to listen to this recording and look forward to discussing further key health and safety topics with you in the coming months. Thank you and take care.